Hello again. Welcome to another one of our videos about the Joint Commission's new Accreditation 360 process. This is actually part two of the National Performance Goals discussion. Still going to be kind of a high-level discussion. We'll start to get into the weeds here in the next one. Again, we're trying to keep these down to about 30 minutes. You can see we've got a little bit smaller group today. We've got Dr. Edwin Lofton, and Monica Stone with us today. A lot of people are out doing surveys, working with clients now, so that's great. We just want to talk a little bit today about what's going on with the survey process, what's in the national performance goals. Again, we invite you to go back and look at the videos that we posted earlier. This is the third or the fourth? This is the third. Third. Okay, I'm starting to lose track. I'm getting old. So feel free to go back. You can reach that link on our website, mslhealthcare.com. And so let's just jump right into it. So I'll start out with you, Edwin. Tell me a little bit, basically what are the national performance goals in general terms?
So in the A360 rewrite from the Joint Commission, there is one new chapter, and that is the national performance goals. It's interesting as you read it, and Monica and I offline beforehand were saying every time we've read it and read it, we pick up another nuance within the national performance goals. But it is a compilation of a lot of standards from other chapters. It's actually brought in standards and EPs from, and I'm going to read the list here, from the National Patient Safety Goals, from LD, IM, PC, MM, and PE, EC, IC, RI, NR, and HR. So it has actually pulled in some standards from almost every chapter within the 2025 Joint Commission standards. And our interpretation of that, and not just interpretation, but it's pretty clearly evident in that, is that the Joint Commission, in compliance and in partnership with CMS codes, is looking at alignment of governance, executive leadership, performance improvement, and outcomes. That's evidence. There are two new standards, and I think one of those standards in particular, but both of them point to that evidence of the alignment of governance and outcomes. And one of those two standards is NPG 020101, and it states that the mission, vision, and goals of an organization must drive the actions of the organization. And as you read through the standards, whether it's in NPG or other chapters, they've used nuanced language that's very interesting, and you really have to measure your performance improvement outcomes against what your goals were, against what your mission was, against what your vision was. So, and I think Monica will like this, it's really Baldrige-esque in the use of PI terms. Now, the other brand new standard that's within NPG is NPG 050201. And I didn't actually pick up on this standard until a couple of days ago in preparation for this. And that is a infection control standard related specifically to high consequence infection control. It is the pandemic standard. It is requiring all hospitals to have a pandemic plan in writing, in policy, having been tested and evaluated. And how did you evaluate the education and preparation for that standard? So, again, in summary, the National Performance Goals, brand new standard, it's looking at alignment of governance and leadership into what PI processes you do and what are the actual outcomes that you're driving.
It's interesting, all the hazard vulnerability analysis we used to do, the pandemic was always the top of those lists. And nobody ever really knew what it meant until, March of 2020.
Exactly.
Now we totally get it. So it's interesting that.
They in some of that language about the hazardous vulnerability assessments, that is also within NPG. And they are using the all hazards approach to everything they're doing. And I said this before, but I think it's worth repeating, that the focus on performance improvement of doing an evaluation, doing a drill, and then using a PI methodology to evaluate the effectiveness of the drill. And if it did not create the outcomes you needed, go and do it again.
Mm-hmm. that seems like kind of a no-brainer, but let me, I guess, add on to that. So what's the purpose of adding this chapter, do you think? I mean, what do you think the intent of it was?
Mm-hmm. Severalfold for the addition of this chapter. One, it creates an alignment within the standards that is very specifically related to CMS conditions of participation. That is evidence when you, and I would encourage everybody, if you have not downloaded the crosswalk between COPs, 25 standards, and A360, I encourage you to do that. It's directly on the Joint Commission website, very easy to do, and you can. In reading that, you'll see where those references are. It also does a lot of removing of the silos of hospital organizations from a measurement perspective. It brings the physical environment, the clinical staff, the facility staff together in how they approach standards and how they're measured. And again, the measurements of performance improvement are how did the education that was designed and used impact the outcome? How did the outcome measure to the intended outcome? How did you adjust your process to improve that alignment? And our interpretation too is really looking at the organization's governance and executive leadership. Many times throughout both the National Performance Goal standards and many other standards within A360, it refers to the ownership of the process. The ownership of the outcome is with governance and executive leadership. That is said stronger now than I've ever seen in my X number of years of practice.
Well, and that's interesting. And I learn every time we do one of these a little bit, not only about Joint Commission and about healthcare, but also about MSL. I'm thinking, wow, there's an area where we could improve too. I mean, we talked about our mission vision being beyond compliance, safety beyond compliance. I don't know that we do an adequate job of actually measuring that result. Of course, I've been saying that for years in our meetings at the end of the year. It's like, how do we measure that? How do we prove that? Now, this seems like this is going to give us an opportunity to actually do that. So I'm afraid Monica might be falling asleep on us. I want to get her off the bench and ask her. So are there any of these standards? Because I think I've incorrectly described the MPG as being what's different than what the COPs are. In other words, there's the new part that's connected to the COPs, and then the MPGs, the other stuff. But are there some standards that are connected in MPG to the COPs? We should probably stop using so many acronyms.
No, you're absolutely right. On first blush, when we first started really diving into these, it looked like all of the national performance goals were those standards that were not associated with any CMS standards or conditions of participation. But in more detailed look, there's actually 4 of the national performance goals that are associated with CMS standards and conditions of participation. And I think it's worth calling out because several of them are areas that we've really, in doing Joint Commission surveys or mock surveys, and the Joint Commission itself, when you look at their survey guide, they didn't focus on these areas that they're bringing out in the national performance goals. The first one is pretty clear. It is the old National Patient Safety Goal 15 related to suicide ideation and the risk assessments and everything. That is now placed in National Performance Goal 080101. The only difference is it brings in the EC standard related to the environmental assessment for suicidal risk is now part of the NPG 080101. And it is associated with the CMS standard. I have to look at my notes to cite the actual standard. The actual standard is, wow, I just lost that. Hold on. So sorry.
Sorry.
Here it is. CMS 482.13C2. The patient has a right to receive care in a safe setting. So that's the CMS condition of participation that it's aligned with. which it hasn't been before as far as the national patient safety goal around suicidal ideation. So that's one big change. The other one that is the next three actually of the national national performance goals that have CMS alignment is 120101, and there's multiple EPs, and it's around ancillary service staffing. And this is something that's been in the conditions of participation and in the CMS standards, but in actual survey practices, we really didn't see a lot of focus on this. So I think you're going to see that focus now. The first EP is around, all of it is around providing adequate staffing and adequately qualified staffing in ancillary areas, including medical record services, dietetic services, pharmacy services, radiological services, and surgical services, and that the governing body appoints the infection preventionist. So it's kind of pulling in all of these multiple CMS tags under one national performance goal related to staffing and staffing qualifications.
Monica, I find it interesting there as well in that the nurse executive directs the implementation of nursing plans has been moved to that 12.0201 as well.
Yes. And all of these have, not all of them, but most of them also have a leadership component that's been drawn into the national performance goal, as well as an HR component. So they're pulling in parts and pieces of these different standards and putting all the staffing things under one national performance goal. But this one, again, just to emphasize, is related to CMS conditions of participation and standards.
Go ahead.
Go ahead.
I say it's kind of interesting that you mentioned some of the stuff that has always been there, but hasn't necessarily been surveyed. Because before we jumped on here, I was meeting with a health system that we're doing some bespoke education for, kind of taking what's new and tailoring it to their organization. And one of the things that I said is particularly related to the life safety chapter is the door is kind of open. We always kind of surveyed within the box of the life safety chapter, at least since the life safety chapter came out. And the surveyors have always kind of surveyed within that same box. But now, because there's just one standard that references a whole library of codes and standards, it really opens the door to a whole lot more. And that seems to be a common thread throughout this change. Is that a fair assessment?
It is. I absolutely think that is true. It's going to really push people to think outside the box, I believe, a little bit more and more collaboratively across the departments. And even in these national performance goal standards that are related to COPs, they're pushing together the outpatient departments, the ancillary departments, and nursing, kind of mushing all those staffing questions together to really, I believe, to help leaders collaborate better on how operations are done. Great. There are two more I want to mention, if you don't mind.
Sure, yeah.
National performance goals. The third one is the 120201, which is the nurse executive implements a staffing plan, which Edwin just mentioned a second ago. This one really gets into the leadership and the HR standards, and gets into the specifics around nursing services and how nursing services is led throughout the organization. It includes leadership standards, the NR standards. It relates back to the CMS condition of participation standard organizations. The standard related to organization that says you must have an organized nursing service for patient care. And it gets into details about that in this national performance goal. It gets into that you have to have the adequate numbers of nurses, LPNs, and all of the nursing types of roles, that you have to have adequate numbers, adequate qualifications. They all have to be, supervised by a registered nurse. It gets into a lot of that detail here, but it does tie it back to the conditions of participation and the standards around organization. Then 482.23, which is the standard staffing and delivery of care. And I think there's one other condition that it aligns with. Nursing service, of course. How could I forget that one? So just that one national performance goal is aligned with 3 different conditions of participation. And the last one I found really, as I was researching it, and just a word of warning, if you go to look at the crosswalk that Edwin referenced for this particular standard, I couldn't find it in the crosswalk anywhere, but it is in the National Patient Safety Goal, the National Performance Goal standard, and it's 120301, and it's around psychiatric hospitals develop and implement staffing plans per law and regulations, is the summary of the title. And there's numerous CMS standards and conditions of participation that are cited on this one. The COP is 482.62, and there are 4 subsections of that it's tied to. So it gets pretty specific around the staffing for the psychiatric hospitals. So you won't find that in the crosswalk, but it is in the National Performance Goal chapter, unless they update their crosswalk, of course. But so those are the 4 that kind of break the mold of being the national performance goals that they align with COPs, whereas the rest of them go above and beyond what's required by the COPs and standards.
So since you mentioned going the MPG, and that's the reason I haven't said the national performance goals, because I knew one of us was going to say national patient safety goals.
It's hard.
For how long now? I don't know, 10, 12, more years than any of us care to count. You tend to think of the COPs as being, the most important part, right? I mean, that's what matters in terms of making sure that we're in alignment with CMS and we get paid. Is there any difference in the scoring or the weight from your perception of the MPG, as said it, and the rest of the standards in the manual? Either one of you.
I think this is the one great mystery of this Accreditation 360 change that I don't think we have the answer to yet. That, is it going to be surveyed, or is the National Performance Goal chapter going to be surveyed as the others? Edwin, what is your thought on that?
I agree. I think this is the black box that the Joint Commission is working within. How the NPG as a standalone chapter and all other chapters are going to be placed in the Safer Matrix scoring system. There has been no literature that I've seen that has come out from the Joint Commission stating anything about that. And I think that will be probably not until the fall of this year or even early in 26 as they begin their scoring. As always, the Joint Commission typically does their early January boot camp for all their surveyors. That's where I think we're going to start to see a bleeding of information. Probably a bad analogy, a large dump of information coming from not only the leadership of the Joint Commission, but from the surveyors who are now being tasked to survey on A360. And where does NPG fall in here?
Yeah, absolutely.
We got a little bit of, got to be careful, insider information from some surveyors last week at a conference. And, there's a lot of confusion. I'm just going to leave it there for now. There's a lot of confusion in how this is all going to work out. So hopefully, I think you're right. There's going to be a lot that comes out of that. I know that, going into October, or the first week of October, we have a meeting with Joint Commission, the consultants forum they have every year. I'm hoping, some of this might filter down then. And we may be having we will be having another video right after that, regardless of if it exactly everything that we predicted, or if there's some changes to either say, hey, we're on track the whole time, or we're going to take a little bit of a turn. This is what we've heard. And so that'll be forthcoming. But, we wanted to start getting this information out because we knew a lot of people were scrambling, trying to figure out what's going on. So there is some speculation that's happening here, but I think it's certainly educated speculation on our part. So it'll be interesting to see how this gets adjusted to in 2026 and even into probably 2027 as they learn and do their surveys. I know this is a clinical question, even though we're, The MPG, by the way, I would highly recommend anybody that's a physical environment person out there. They need to go and read this chapter as well, because there's a lot of stuff. If you guys remember when we were at our company meeting in December, we were talking about how we really need to try to break down the silos between clinical and non-clinical teams in the hospitals. And it seems like this is an effort to sort of do that. This whole standard restructuring is a way of almost forcing that interaction between the two. But wave testing, that's only in the MPG. Is that correct?
So, yes, you're correct. And I've read, reread, and reread this, and I've done the search on the crosswalk trying to find everything related to it. Wave testing as a standalone is only in NPG 10.0101 and 10.0201. And one of those is related to the staff who are performing wave testing. Have they been trained? How have they been educated? Did you do PI on their education? Was it effective? What was the outcome? Does that sound familiar? And then in the MPG 10.0201, that's about, and I may have those backwards, that's about the leadership who is responsible for wave testing. I think of note within here is how the Joint Commission has somewhat separated the standards language around wave testing and non-wave testing. All of the non-waved testing standards have been moved into a variety of other chapters and standards within leadership, nursing, HR, and patient care. And each one of those non-wave standards has really been absorbed into leadership accountability for having the right testing, having the right qualifications, and having the right education. So yes, this is a clinical nature, but it follows the consistent language within A360 of break down the silos. Leadership is responsible for everything in the organization, whether it's at the bedside or in the water tower.
Mm-hmm. Good way to summarize it, I think. So I'm going to ask what might be kind of a loaded question, and maybe I shouldn't, but I'm going to anyway. So, in the old days, like last week, you both have been in this position where you were responsible for hospitals being accredited. You kind of had to carry the ball, so to speak. And so leadership, whether at a board level or the C-suite level, could kind of hand that ball to someone and say, make sure we get through this survey and we're all compliant and everything. It feels like it's going to be harder for people at the senior leadership levels to kind of hand off the ball and say, carry it across the finish line and let me know how, because traditionally what has happened is, they shake all the hands and do the warm greetings, and then they go back to work for 3 or 4 days, and then they come to the summation. And maybe I'm overstating that, but it sort of feels that way. Is that, do you both feel that that's a reasonable representation of what's coming in the future?
In short, yes. And an analogy real quickly. Last week, I happened to be having a face-to-face conversation with the CEO who is a friend of mine who I recently worked for. And I asked him, I said, how are you aware of Joint Commission's A360 and the impacts on outcomes, patient care, and survey process? He says, well, whatever I've read in modern healthcare, whatever's been pushed to me by this organization, that organization. I said, so are you aware of standard X? And I read him 3 or 4 of the standards that refers to the ownership of governance and executive leadership. That led into about a 35-minute conversation. At the end, his comment was, OMG, I'm going to have to be prepared like I've never been before. And I think he's correct.
And I think if you go to the survey process guide and look at how these standards are going to be surveyed and use that to kind of crosswalk, what are you currently doing to demonstrate your governance and leadership involvement, and what do you need to be doing going forward? Because I think what they're not just going to look for that the executives can come in for a few minutes and speak to a few performance improvement projects, or the annual report to the board on HR or whatever other annual reports go there. But they're going to look for evidence of their continual involvement through the minutes of the various committees, of the board of directors or board of governors. They're going to look for evidence of involvement throughout the year in the operations and leadership and governance of the organization.
And Monica, very excellent point. The survey process guide, as we have said in previous webinars, and we'll say again, it's grown from 160 some odd pages to 690 plus pages, and is very prescriptive. And within that, to your point, Monica, documents that are now required that have never been required before. Two that stand out to me around the subject of executive leadership. One is who is on staff, and you have to provide an entire roster of all employed and contracted personnel. That raises several questions. And the second thing is you have to provide the annual budget. That line has never been in the standards before. And that's going to lead the surveyors into looking at, if you had a capital project for implementation of robotics, how did you evaluate the need? Is the outcome what you thought it was? How did you spend the money? Did you do a performance improvement plan on the cost benefit? And what's the outcome of patient care? That's a governance question.
Yes. So they're not only asking, what are you doing, but they're looking at and asking, how are you doing it? And they're two very different questions, and the how gets very detailed.
I think it's ironic that because we're all trying not to say national patient safety goals, that when we say national process goals, we emphasize the word process, which is probably the goal of this change anyway. But it's like we're almost forced to emphasize how important process is going to be going forward and being able to articulate process. So certainly a push towards greater involvement with leadership, which I think is a good thing. I think that's always been something, as being on the survey side of the house and the preparation side of the house, a little frustrating sometimes that there hasn't been more of a draw to the leadership. So I don't know how you guys feel, but that's always been something for me. So I think that's all positive steps for this. It's going to be definitely a change, going forward, at least initially. I think we've seen it before. It doesn't scare me as much as it did when they went from, when they rewrote the manual the first time, I guess about 20 years ago. Of course, I was 20 years younger than too, so nothing scares me as much anymore. Anything else you guys want to bring up or add or can think of? I know we've got several other of these coming up, so.
I think from an overview perspective, between what Steve, your questions, Monica, and my responses, it gives you a flavor of what to go into. As Monica and I have said, offline before this, every time we review it, we find out different nuances. And as we research not just in the National Performance Goals chapter, but all of the chapters and the nuance and language, that's going to be the secret sauce. And, Steve, from your perspective, and we're committed to it, MSL is here to help our partners and go through that discovery and do as much research for you as we can.
Awesome. Well, I appreciate both of you jumping on and doing this today. We got a couple of things that I want to mention is we talked about it before we went live about, should we start breaking these into kind of physical environment and clinical? And we realize there's really no delineation like there used to be. And so it's important to kind of keep these in alignment. We do have a list that we're going to, a schedule, if you will, that we'll publish here pretty soon. So you can kind of see what topics are going to be coming up. Again, we're going to try to keep these going every 2 weeks. I want to remind those people who are a part of our Accreditation Readiness Network that if you're one of those members, you can earn CECs for this. So make sure you do that, watch it on that platform, answer the questions, and get your continuing education certificates. So thank you once again for joining us. We look forward to seeing you in a couple of weeks. If we can do anything for you, feel free to reach out to any of us at MSL. You can reach us at mslhealthcare.com. Thank you.